And welcome to our 9th COVID Community Town Hall, sponsored by the Stanford School of Medicine Office of Community Engagement, as well as the Department of Epidemiology and Population Health. My name is Lisa Goldman Rosas, and I'm an assistant professor here in the Department of Epidemiology and Population Health, and I get to direct the School of Medicine Office of Community Engagement. And today, I'm very pleased to be the moderator. Y como siempre, antes de empezar, bienvenidos a todos y todas que nos están escuchando en español. Qué bueno que nos hayan acompañado el día de hoy. Y gracias a Claudia Esperanza, quienes van a estar haciendo la interpretación el día de hoy. Si quieren escuchar en español, favor de hacer clic aquí abajo donde dice Interpretation. Okay. All right. I am so excited about today's town hall. First of all, it was almost exactly 12 months ago to the day that we hosted our first town hall. And I feel like we have come so far as a community since then. Through these town halls, we've gotten to learn from a range of experts about topics like the epidemiology of the pandemic, different types of testing, how to support adolescent mental health, and of course, a lot about vaccines. It has been such a pleasure to share this Zoom room with all our invited panelists, and most importantly, with all of you, our attendees, because without you, it wouldn't be so fun. So the second reason I'm so excited is because today we're talking about the challenges and successes of community-led vaccination campaigns. And that means we get to talk to some of the people in the trenches that have been doing the hard work of getting the vaccine out into our community. So I'm really excited to talk to these panelists. Let's see. Speaking of the panelists and question and answers, some of you submitted questions ahead of time in your registration. And we will try to get to those questions as soon as we can. Oh, thank you for the slides. You can advance the slides. Forgot about the slides. We'll try to get to as many of those questions as possible. There you go. But please, during the event, use that question and answer button. We will be monitoring that. We can answer some questions by typing in answers as we go, and we will answer a lot of the questions live. If we don't get to your specific question, just hold tight. Hopefully, we will get at least to the topic. And I know our panelists have submitted a tremendous number of resources that are on our webpage as well. Y también, si quieren poner preguntas en español, adelante. Okay. Now, before I introduce our panelists, I want to give a shout out to the whole Office of Community Engagement team. So Glenda, Wei Ting, Olivia, Patricia. So they are working so hard to make these events fun for all of us. And you are probably not surprised, but you can see here they have planned town halls for May, July, and August. If any of our attendees have ideas for topics that you'd like to see, please go ahead and put those in the question and answer or the chat. Okay, you can go to the next slide. Wonderful. So now I get to introduce our wonderful speakers and panelists for today. So we have 5 panelists that come from different parts of our community and have been working really hard around the vaccine campaigns. So first we have Ruben Abrica. He is the Vice Mayor of East Palo Alto. Second, we have Mike González, the Manager of Community Resource Center at Santa Clara Family Health Plan. I saw he gave you a wave. We have Rita Mancera. She is the Executive Director of Puente in Pescadero. Hi, Rita. And then we have Tim Seay-Morrison. He is the Executive Director of Ambulatory Care and Service Lines at Stanford Healthcare, and most importantly, been directing the COVID-19 healthcare workforce response team. So he's been just a little bit busy. And then we have Erin Tormey. She is the founder of the Coastside Farmers Market in Half Moon Bay and Pacifica. So for each panelist, we'll be going one by one, and some of them have some slides to share with you. And as you know, I always like to ask the panelists to answer an icebreaker question so we can get to know them personally, just a little bit anyway. So today, since it's such a nice warm day in the Bay Area and we're talking about vaccines and getting them out into our community, I thought I would ask each of the panelists to share what's your favorite part about spring. And I'll go first because I was thinking about this. I love to go hiking outside here, and my favorite part about spring is seeing the wildflowers, and they have been especially beautiful this year. Okay, with that, I am going to turn it over to Ruben. And I'm not sure if you have slides, Ruben, but if you do,
I don't.
Okay, great. Then you can just go ahead and answer the question and we can stop sharing those slides.
Well, around springtime, I like to start thinking about the beach. And so that's what I'm doing right now. Preferably a warmer beach down in Northern California, but the beach nevertheless.
Wonderful. You can go ahead with anything you'd like to share.
Oh, okay.
Oh, I'm sorry. You want me to
yeah,
do my little presentation now?
You can present now.
Yeah. I'm sorry. Yeah, I thought it was going to go around, but yeah, my name is Ruben Abrica. In Espanol is Ruben Abrica. Currently serve as the vice mayor in East Palo Alto, and I'm an instructor at the ANSA Community College in the Intercultural International Studies division. And these days, I also serve as a translator in some of the vaccination events in our community. There's always a need for translators, so I do that. I want to share a few things about our city in East Palo Alto, particularly that I think are relevant during this pandemic. And then also explain and kind of reflect a little bit on the campaign, the vaccination campaign that's taking place in sort of different aspects. So we're a small city, 2.5 square miles, right next to Palo Alto, but we're in San Mateo County. The creek is the dividing county line. And we're about 30,000 people, therefore very densely populated. And we actually have a west side and an east side divided by 101. The west side is primarily apartment buildings. And in fact, our population is about 60% renter occupied, which is, we know, another factor that not only our community, but all communities are affected by the density of how people are living. The occupational profile of our community, more than 60% of our people who are employed do the frontline kinds of jobs, working in restaurants and retail and construction, healthcare, and in terms of the housing, our 25% of all our households are considered overcrowded, 36% of the renter occupied. So those two things have really hit us pretty hard. And again, we're not the only ones, but those two factors have really made it very difficult times for us. We're a very diverse population, 66% Latino, 11% African American, 10% Asian and Pacific, Islanders, 10% European Americans, 3% others. Our median income is 67%, which is way below what the county is, about 143,000. And, even internal to our community, we have some disparities. So the west side is only 57,000, and two neighborhoods on the east side, the Gardens and Weeks, are up to 98%. About 39% of our population is born in another country. 70% of the households speak a language other than English. So in combination, you kind of get a picture of, some of the challenges that we face. In terms of the vaccination campaign, I'll speak a little bit, which, by the way, I feel that all of us are really responding to a very disjointed and very fragmented and in some ways very inefficient response system. And I think that's just the general come. So I think we do the best that we can. The city of East Palo Alto, I have to say, we have two main partners that we are working with. One is the clinic, the Ravenswood Clinic, the San Mateo County, the whole structure, healthcare and other offices. We also have, teamed up with Facebook, with the school district to expand the number of sites that can be used for vaccinations. Also churches. We obviously also connect with a lot of community groups, nonprofits, as well as other groups to help us with that process. In terms of the implementation on the ground, we're a poor city relative to many other ones, but the city council just authorized about $300,000 2 weeks ago in order to hire a group of people full-time, temporary, to really accelerate the vaccination rate. Because, we're close to 50% of all our people being vaccinated, but that's below what we want to get 70, 80%, 90%. And so we felt this was the time to do that, to really put some resources. Those people are going to businesses, to churches, to every nonprofit, every group in the community, taking posters, taking flyers, even doing canvassing. So that's been very, very important. One thing that, we probably could have done earlier is to produce, and I did send that as a resource, the mayor and I, as the vice mayor, every week we meet with the city manager, with other staff, who in turn have talked to the county and talked to other community groups. And we now produce a weekly calendar. So if you go on the website of East Palo Alto today, you can find a calendar of all the events taking place in East Palo Alto or around East Palo Alto. Whether it's the county doing it, the clinic doing, Stanford Healthcare, any place where our people can go to. So that's been a good innovation. The other thing, it's a hotline, a bilingual hotline, information. So you can call 665-0482 anytime now, and you will get sort of the latest information. You will get a live person, or somebody will call you right back, and people can actually even sign up with them. So again, I think that's something that probably could have started a lot earlier, but it's never too late these days. We have to really, I feel, promote vaccinations. And I'm a member of a group that works with seniors, and I also send a flyer out as a resource, for tonight, because we want to go. We're encouraging every organization to do their own canvassing, because they have their own networks. They have their own way of reaching certain people, certain groups of people. And so we're doing a canvassing, and we're going to be going door to door and distribute that this week we really feel that this is the time to really intensify all efforts to try to reach as many people, because there are starting to be more vaccinations, more sites. And so, it continues to be a challenge, but we feel that we're on the right track right now. The county started doing mass vaccination sites, but those were very difficult for many people to get to, because they were too central, way off over there someplace. And so they started doing more on-site, which is good. And now they have opened up mass vaccination places again, but not at the expense of doing local, neighborhood-based, locally based, events. So, I'll leave it at that. I would say that we anticipate the next 2-3 weeks to be very, very intensive times. And we're really calling on the community itself, on our own community, to respond through their own networks, through the churches, through their clubs, sports teams, businesses, every which way, that we've got to get people vaccinated in order to protect people, their families, everybody. And once Stanford Medical Network, all the different entities and the Office of Community Engagement. Gracias. Y pues nada más quiero decir en español, algo en español, que hay que seguir con la conversación, hay que seguir promoviendo, ayudando a que la gente se vacune para proteger a la comunidad, a las familias y a cada uno de nosotros. Gracias. Thank you.
Gracias, Ruben. Thank you so much. It's really wonderful to hear all the hard work that's been going on in Palo Alto and in East Palo Alto, and I know it's been making a tremendous difference. And I know, like you say, there's still lots of work to do, and even the next weeks are super important. Okay, so we are going to pass it now to Mike González. And Mike, don't forget to share with us your favorite thing about spring. And I think you do have some slides, so we'll let you pull them up while you're sharing, if you can.
Yeah, of course, of course. Actually, I love spring. I'm a big runner. And so I love long distance running when I can during the week and on the weekends especially. So that's what I love about spring. And then my next favorite season will also be fall. With that, I'll share my deck. Let's see if this works. All right.
Looks great.
You see it?
Yep, we see it.
All right, awesome. So let me move my little photo. I see your face here, so I'm going to move you over so I can see the screen here. All right, well, ¿qué tal todos? Muy buenas tardes. Un placer para estar aquí con ustedes. My name is Mike González, and I work with Santa Clara Family Health Plan. We are located in Santa Clara County. We are a local nonprofit public organization dedicated to improving the lives of our residents, specifically our Medi-Cal and Cal Medi-Connect members. And so we do that by partnering with our community organizations and our providers in our county. Just to give you sort of a high level look, we have close to 280,000 members that make up our organization in terms of really working to advance their health. And so we have a big responsibility, which we take pride every day in doing. But we do also acknowledge and understand the severity of the pandemic when it comes to our family and children, especially among our Black, African ancestry, Latino, Asian, and Pacific Islander communities in our county. They are really, really suffering right at this time when it comes to disproportionate affected results from the pandemic. And so when we think about the vaccination efforts, here is a slide that really shows how we're doing in our county. So this is really an age group band that really shows how we're doing versus with the county versus how we're doing with our members. And again, when I say members, our Medi-Cal members. And so the orange describes the percentage age group that the county is doing, how they're doing as a county, right, overall. And then the blue demonstrates how we're doing within our Santa Clara Family Health Plan members. And so loud and clear, it says that we have a lot of work to do when it comes to our Latino and, when it comes within our age groups of 50 to 64 and 16 to 49. We want to do a lot of work there, and I'll talk about that in a minute. But when we think about our ethnic groups, this is where it really demonstrates loud and clear what we need to do in terms of targeted population outreach. Our Latinos, probably not surprising here, but our Latino population as well as our African ancestry populations, we're not doing very well in terms of getting them vaccinated, right? Also really important to say that 40% of our Latinos make up the health plan. So we have a lot of work to do here. And again, the reason why we're all here today is to talk about vaccination efforts, but also increasing vaccine confidence. And so I want to share now a map of our county. For those of you who are familiar with our county and also not familiar with our county, this is a map of our members, of our Medi-Cal members. And where you see the most red is where the most increased concentrations of our members, where they live, right? And so if you are familiar with our county, the bottom portion, red part, is Gilroy. And the east side is another portion that you see a lot of red there. That's our East San Jose community, our Alum Rock community. These are areas that our families, that our members mostly live in, right? But most interesting enough, if you can keep your mind at this, keep your mind in this image here of the map. Here's another map of sort of the COVID cases in our county as of last week. You can see the difference where we had red earlier, where the darkest blue here represents the hardest hit COVID-19 cases in our county. It's very, very dire. It's very hard in our communities. And of course, the hardest hit communities not only are the most bluest, darkest blue, but also are our Medi-Cal members communities. And so I highlighted a box there, 95127. Thank you very much to our partners at the Equity Atlas for this infographic here, but 95127 is one of the hardest hit zip codes in our east side. One thing I like to say is that I really do have a lot of joy working for the health plan, because we just opened up a new Blanca Alvarado Community Resource Center in East San Jose. It's not fully open to the public yet, but it will become a beacon of hope when it comes to really advancing resources in the east side. Again, really important to share that East San Jose fairly sort of disproportionately, unfortunately, fare worse when it comes to social, economic, and environmental factors. And so it's really nice to have this center here. For those of you who know San Jose, we are off of McKee and Capitol. So we see the center playing a really, really, really big role during and post-pandemic. And so right now, our center has been activated as a mobile vaccine clinic, which are simply pop-up clinics, right? We try to have them as much as possible. It is a strategy. These pop-up clinics is a strategy to really break down barriers and increase access for our most underserved and impacted communities. No appointments are necessary. By eliminating the needs of appointments, we aim to really reach people who might not have access to internet or computers. These vaccine clinics are not done by us alone. We're doing this in partnership with Santa Clara County Emergency Operations Center and their awesome mobile vaccine clinic unit. What we're responsible for doing is that we are the host site, right? We host a site and we're responsible for doing all the outreach, which is not easy to do. And we'll talk about that more in a minute. And so this last month, we're able to really administer over 800 vaccines just this month alone in a very low resource hard hit part of the county. And so here is an image of sort of the flow of how a vaccine clinic works. I really want to demonstrate to folks out there who have not been vaccinated that it's a very streamlined, easy process, in and out, right? So look at this. Our hope here is to keep the lines as short as possible. And so now talking about outreach. When I talk about outreach, I'm talking about the hard to reach communities, which they do include our members, right? They're Medi-Cal and Cal Medi-Connect members, and also our at-risk vulnerable communities. There's also a really keen look at intersectionality, because a lot of our members and our at-risk community members are immigrants. They're low income. They don't speak English most often. They are seniors. They're members of the LGBTQ community, and they're also people with special needs and disabilities. So we have to take a holistic approach when we engage them. So first, looking at our health plan members, we've done a lot to really engage them over the last few weeks, from calling to direct mailers. But more importantly, we created a campaign, which I love. It's called Roll Up Your Sleeves Against COVID-19. It's a really fun campaign, I think. We have a lot of great infographics to go along with this. And this has been out and about for the last several weeks. And more importantly, our approach, right? So if any of you out there are looking to not only either hosting one or you currently want to host one, so if you want to like host one in the future or looking to advance yours, here are some lessons learned that not only from my own experience, but really working with our Eastside partners. First, we really want to, if you are doing this, and our hope is that it's not simply just putting on a vaccine clinic, right? You really want to look at how do we increase vaccine availability and confidence. And so by doing that, you first have to determine your target audience. Who are they? Where do they live? And what are their barriers? Initially, when we did clinics, there were long lines, right? There were a ton of people who wanted the vaccine. So people who got the vaccine already got it. If they wanted it, they got it already. Now we're working with a different situation today. And actually what happened last week is very different what's going to happen this week. And so we have to be very, very intentional with our audience. Next, we must also communicate intentionally. So we got to know who they are, what are their languages, what are their cultural and social norms, and who do they trust in this messaging, right? Third, we really want to make sure that we engage and collaborate with traditional and non-traditional partners. The ways of outreach before the pandemic is very, very different today. In the past, you would go to your local say, your local community events or your local social service agency. That's not happening as much anymore. But people are still going to churches and people are still going to buy essential needs. So really partnering with your non-traditional partners is really important. And we must stay in tune with community fears and concerns as it relates to the vaccine. And last, let's not forget social norms. It's actually a proven area when it comes to public health, right? Friends, family, neighbors can really help inform and build confidence. I would tell you, if my mom's comadre tells her something, I'm gonna learn about it. And she lives in San Diego. So it's just, social norms is really big here. So some key takeaways to finish up is that continue implementing and assessing grassroots and technology outreach strategies because we're in a new era, right? A lot of our communities who didn't use technology are now using them today. So how do we use that? If you're gonna host or hold vaccine clinics, please don't make people come to you, you go to them. Host them and, if you are looking to reach the hard to engage or hard to reach community, they are the working class. Do not hold them during the day. Let's do them in the evening and weekends. And keep the lines short and fast, and keep it consistent. Keep the place consistent. Let's not make them hunt for the sites. Let's keep it consistent in places they're familiar with. And some immersion strategies I like to share is really looking at how do we partner better with the youth, right? Peer-to-peer modeling might work here, as well as having the youth encourage their parents to get vaccinated. And another immersion strategy is incentives, right? How do we provide an incentive like a free meal or other essential items to really encourage people to come? And so with that, I want to give a special shout out to East San Jose for really rolling up their sleeves against COVID-19. I got my vaccine last week. With that, I pass it back to you, Lisa.
Awesome, Mike. It's so wonderful to hear all the lessons learned from what you all have been doing. And, I think one of the questions we'll have when we get done is how can other people start to pitch in who are already vaccinated and help? So that's really exciting. Thanks for sharing. All right, now we're going to pass it to Rita. And I think, Rita, do you have slides as well?
No.
Oh, there you are, though. That's wonderful.
But we can take it off in a second. And hi, everyone. My name is Rita Mancera. I'm the executive of Puente. And Puente is a nonprofit organization that serves the South Coast communities of San Mateo County. I'll explain you where we are. And we're here to promote and advocate for equitable access to education, health, and economic security. And I think in order for you to grasp what I'm about to share about the success of, virtually vaccinating 100% of the farm workers in our area, I have to share where we are. So if you've driven on Highway 1 between Santa Cruz and Half Moon Bay on the coast, that's where we are. It's a very vast area. And so we've been listening today about outreach, and it takes us to go to a farm as nothing as 5 minutes, because some of the farms are across our office, all the way to 45 minutes when we have to visit farms up in Portola State Park. And so all of that was a complex system for us to deliver vaccines. And yes, we provided and we partner with a lot of people to provide vaccines to people within the different groups, to seniors at some point, to food workers at another point. But today I kind of want to focus on the work that we did to farm workers. And I hope that I can convey all the things that work and the things that didn't. And please feel free to ask any other questions to follow up. So something I wanted to share is that I think the success, it has to do that CBOs are already a trusted partner for a long time. We didn't just came up with this pandemic. We have been here for the community for a long time through other challenges, including immigration challenges and housing and education and things like that. So when the pandemic hit, we were already positioned to support our community, and I'll focus on vaccines, but we cannot go there if we don't talk about even COVID testing and how people were reluctant to do COVID testing at the beginning. And when they hear this messaging from trusted partners, it's going to be much easier for them to believe that this is a good thing for them to participate in. Now, this is a rural area. The Latinx population is about 50% in our region, and the farm worker population comes from different states in Mexico and from El Salvador and Guatemala. Some of the people that we partner with and provide services to they speak Spanish as their second language, so they speak another language as well. And all of that, I think, make us a really beautiful area. And it also creates some challenges in terms of outreach and the efforts that we have to do in communication. So it's not that we cannot go over the hill, as we call that area, is that everything is about an hour away from us. I mean, the closest smaller city is Half Moon Bay, and there's a lot of services there, like grocery stores and things like that. But in general, for, other types of services, people have to go over the hill. And in our small community, we have a bank, a post office, we don't have a big grocery store, we don't have a laundromat. And so people are used to going out. But we try to bring services here so that people can access those kind of things locally. So when we started thinking about vaccines, and I'm pretty sure that nonprofits and CBO groups, we started thinking about this before vaccines were announced. We were already planning what was going to be the strategy, because we knew that once they were ready to roll, it was going to get chaotic, and it did. And particularly, we wanted to reach out to farm workers. And so I want to share some of the things that I think worked. So like Mike was saying, we didn't wait for people to come to us for the first vaccines. We actually went out to the farms and ranches to provide the vaccines. This is so far unheard of, because in general, you try to get people to a place that is maybe known to them or something. But here we had different constraints, including the long hours that farm workers work. They make very low wages. So any time that they take for their health or as time that is not paid, it has a big impact on their financial situation. So we partner actually with the farmers this time. So we call them all, and to facilitate this registration process, because if you remember at the beginning, they announce all these sites and they send the link, and then they expect that people are going to click the link and then answer all those questions, most of the time in English, and register for a vaccine. And so we have done months of work to get our community to trust that the vaccine was safe. And so they were ready. When the first day the vaccine was announced, we did a survey in our food distribution to see how many people wanted to get the vaccine. More than 75% of the people said they wanted it. And that was our clue. Okay, we're ready to launch this campaign. And so we work with the farmers to actually give us all the information. And can you imagine how much trust that is for a business to tell you their names, their date of birth, their health insurance plan? And so we consolidated all that information to make not appointments, but to make a route to go to the different farms and ranches. I think something else that helped a lot is that all this information, we were communicating, of course, with the farms, but also with the workers directly, especially because in some farms, they said, we're not interested. And so then we skipped them and we went directly to the workers. And the information was in English and Spanish, which is, those are the languages that we use more in our region. But also something to share is that we've been using now, I believe maybe for 3 years, a tool called Talking Points. And we communicate with people that way. We send a text in English and they get it in Spanish or in the language that they have it set up to receive it. And of course, over the pandemic, we moved more into using graphics that were really simple, and they were already in English and Spanish. And so people have been getting all these texts from Puente about different opportunities to get the vaccines, but we have this like very direct way to communicate and a two-way communication. And so when they had questions, we were able to reply and establish that conversation one-on-one. So I think that was a very useful tool. In addition to all your regular outreach, putting flyers, posting on social media. But, here's like some of the farm workers are in social media with us, but not all of them. Some of them are actually next door. Most of them are not. Some of them get the text. Some of them don't. And so at the end of the day, we still have to go to all the farms and make sure that everybody knew that we were coming. Like others have said, we didn't did this alone. We partnered. The biggest partner was San Mateo County, and I always love the county to tell them when I think they need to do a better job. But this time I have to acknowledge them that they have done a good job giving us what we asked for. And we asked for Moderna, and we asked for a specific amount, and we asked for it several times. And every single time they responded. And it's because we have built this long relationship, not just with them, but with our community. So I'm glad that they listened and that they partnered with us. But the other partner, it was our local school district, because our first round was to go to all these farms, but then we also provided community stationary clinics. and we don't have the facilities. I'm actually jealous about Mike and his facilities, but we don't have them. So we have to partner with other folks, and it was great to have access to their facilities, especially because some of the students were not in session, and so it was a little bit easier to manage the logistics. The day of, this is the part that we need to improve. There's this expectation that after all the information farm workers and farmers provided, they still arrive the day of and have to fill out all this other paperwork. So we have to be staffing, and other staff members that have different jobs actually participated and help us do all that registration. Some of the questions are a little bit complicated, and you have to not just translate it, but interpreting them for them in a way that they're gonna know whether to answer yes or no to that. And definitely allocating more staffing, and then technology. We live in an area where there's a good chunk of areas that are not connected to the internet. So all the registration and the actual preparing the cards and everything, it was all like pretty low key. It was all paper driven. And if we had an issue, we kind of have to move to areas where we could send a text to the group that was ahead of us so that everything could work. So those are some of our challenges. And then it comes something that I think is the biggest issue, which is equity. This was an example in which farm workers who, in their own words, very often are not the first one to get anything. And particularly in the last, 4 years, they were actually scared about, any of the administration steps towards immigrants. And so for them to realize that they were actually one of the groups that was given priority, it was in some cases pretty emotional. And in other instances, it was like, okay, finally, they keep saying during the pandemic that farm workers are the heroes. And now they're actually showing that they really think that we are heroes by providing those vaccines. But then the equity issue comes to me on the expectations that are put on organizations that are on the ground. So our partnership included someone to literally come and give the shot in the arm of the person. But as others have shared, we were in charge of the outreach, the registration, setting up, cleaning up, buying food, filling out forms, entering the data, cleaning up the data for other vendors and for other groups. And so we did it because it was important. And I think if it was this kind of emergency, we would do it again. But as we're saying, there has to be a better infrastructure of who's going to be on the other side of the phone, taking this information with people that have to provide a lot of information that they may not have, an easy access to. So I would recommend that when people are looking for partnerships, that there's a better system so that the CBOs are not the ones that are putting like 80% of the work with other groups. That being said, I think that, we literally have helped get 100% of the farm workers in our region vaccinated. We had a meeting with one of the supervisors, county supervisors last week. And one of his questions was, raise your hand if you have gotten the vaccine. And then everybody raised their hand. When have we seen things like that? So I'm proud of the work, and I will be very happy to answer any other questions that come up about that.
Rita, thank you so much for sharing your experience. It's truly tremendous to hear the work that you all have done through the whole pandemic, and especially around the vaccinations. And we really appreciate you sharing the additional burden that so many of our community-based organization partners have felt during this time. And I'm sure there will be questions about that. All right, so we're going to shift gears a little bit, and our next speaker is Tim from Stanford Healthcare. And Tim, you can also share what you like about spring.
Great. Thank you for having me, Mue. Nice to see you. And I'm pulling up my screen as well, but I lost it. Let's see, what do I love about spring? What I mostly love is that the days get a little bit longer, because it's sort of the super short, dark in the morning and dark at night of the winter gets me down. And I love living here in the north where it's so light from 5 a.m. to 9 p.m. once the summer rolls. So the spring makes me feel like we're headed in that direction. And let's see if I'm getting my screen right. How's that?
Looks good now.
Great. Buenas tardes a todos. My name is Seay-Morrison. I do work for Stanford Healthcare, as Lisa said, and I've been pleased and challenged to work with so many great people in the last year as we've responded to COVID-19 as a health system. And so I just sort of start with this picture of a lot of people who've been engaged in the work and all of the kinds of things we've done, and the fact that they're still smiling under their masks after this year of challenge, I think, is just the inspiration of what it's meant to pull together and be part of such an interesting time, as the other speakers have shared. What a challenge and a privilege at the same time to see what we need to do as a community. This is just a quick reflection of Stanford's been administering a lot of vaccines, but we're very spread out. And so this year really taught us about the fact that we have presence in a lot of places throughout the Bay Area. And we've been really thinking, how do we do that really well? How do we support multiple communities with many different needs, and learn in a way that has been so challenging and interesting? And this is where our current vaccine sites are. And I'll talk a little bit about sort of what we've learned about those and our challenges and what it means to be Stanford Healthcare at this time. One of our sort of most exciting components, and I was glad to hear Mike talk about East San Jose. The County of Santa Clara asked us to partner on something, especially for East San Jose. And for us, Stanford's not present there, and we wouldn't have been able to go there without the partnership of the City of San Jose and the County of Santa Clara, and also this beautiful roller rink and owner who's Liz, who's committed to the people of East San Jose. And so it's a privilege for us to have been able to partner so closely and get there. And I think provide what was needed, but what was told to us was needed by the County of Santa Clara. And it happens to be, I think, the most fun vaccine site, because you get to sit in the middle of the roller rink and there's these big inflatable hoops. And it also just sort of has been generating the excitement about the fact that this work and the vaccines are going to bring us back to being with our community and doing fun things again in the future. And so this site has, I think, invigorated just a great deal of energy about the hope that vaccines have provided. There's some, I think, pretty significant challenges and lessons learned in the last year. And so as a health system, we provide healthcare, that's what we know, and we're not a community health system. We're a health system that has typically provided very highly specialized care, where we don't have deep roots in sort of local community care, because that's not the kind of health system that Stanford is. And so the pandemic, I think, really helped us to advance our thinking and be part of the communities in which we sit in a very different way. And I think in quite humbling, Stanford has a very complex relationship with the communities it's been in, and Stanford has not, we are many things, and we are a very large entity that is not just a health system, but we have not always served our community well. And I think there's been plenty of criticism about how Stanford could do more. What can Stanford do? And I think we recognize that and thought very, very carefully about the fact that this pandemic really taught us Stanford can't dictate what the community needs or how the community can heal from this. How can we best position ourselves to serve and be present? And I think that was a pretty significant shift for how we've approached healthcare, at least in my time with Stanford. We, of course, got thrust into testing and the demand to do COVID testing in a big way, and all of the panic that existed early on in the pandemic. And we opened a bunch of sites, but it was very reactive and going as fast as we can. And so what the vaccines gave us the chance to do, I think, much like Rita said, we were able to think about that in advance because we had learned so much from testing. How do we do this differently? And so we were able to stand up I think, our relationships and partnerships with the counties much more proactively as we thought about vaccine management. And we work with several counties because we're in many locations, and all of them work very differently. Each of the public health agencies is quite different. And so we got to be responsive in a variety of ways. We're good at some things at Stanford, and I think we know what we're good at, and we can provide these large scale, big kind of things. And that isn't, as you've heard the other speakers say, isn't exactly what will be needed in the long run for vaccination. And so it's really challenged us to be as nimble and responsive as possible. And also, because we're not expert in everything, spend a lot more time listening and responding to what our community partners need from us. And the vaccine experience, since we had some lessons, like I said, from the testing work, really let us do some proactive work and ask a lot more questions it seemed like forever, right? We had like 6 weeks to plan or something, but in those few weeks we had to plan for the initial rollout of vaccination, what are we going to be able to do to all of us band together? I think that's been a really important and exciting part of being with Stanford. And what we have now is the challenge of sort of the stamina to keep going forward. The kind of things we provided last week, as Mike said, and this week are not going to be the things that meet the needs of the community in the weeks ahead. And so how quickly can we keep moving to help draw people toward getting vaccinated? And how can we partner and provide education and support in the areas that need it? And most importantly for a place like Stanford is, because we're not in all of those locations, we just really have relied on and will continue to rely on hearing what community organizations, the nonprofits, the CBOs, and the counties are hearing from the residents and the constituents and the people who receive services about what's going to work. And we'll do our best to respond. So we've learned a great deal, and I think we just are very grateful to have been in this position this year and look forward to the months ahead and the very long tail that it is, but the fact that we'll keep seeing the vaccination rates go up and that we can continue to help all of our partners achieve their goals and reaching the residents of the communities. So thank you so much. Gracias a todos por venir y espero escuchar sus preguntas y comentarios después. Thanks, Lisa.
Thank you so much, Tim. I had no idea that you spoke Spanish. Good. That's awesome. And thank you so much also for acknowledging the challenges that Stanford has had in being a good community partner. And I couldn't agree more that nothing like a pandemic to change the way we do business. And I think so many of us are grateful to our community partners and every day hope to be a better partner in the community. Okay, so last and certainly not least, we have Erin Tormey from the Coastside Farmers Market in Half Moon Bay and Pacifica. So we'll go back to the ocean. And I know, Erin, I'm sure you have something to share about what you like about spring. And I'll let you pull up your slides while you're talking.
Okay. Hi. My name is Erin. I'm a farmer out in Half Moon Bay. Buenas tardes todos. Me llamo Erin Tormey. Estoy en agricultura en Half Moon Bay. And that's about the extent of my Spanish. I do my best. Anyway, I am going to just pop up oh dear. Get this going for y'all.
You got this.
I'm sure I do. I don't know. That's not quite what I meant to have up there. Let me see if I can remember where she said to put that.
2 buttons over and you're almost there. Other way.
That one.
Keep going. Keep going.
That one.
Next one. There you go.
Hey.
You did it.
Well,
thanks, Erin.
I don't spend a lot of time with PowerPoint in my line of work, but so I'm really happy to be here. The greatest thing about spring is that everything is getting born. There are babies all over my ranch. There are pregnant cows in places there are. We're at that point where things are coming up, and the work we put in over the winter to nourish our soil and ourselves is appearing, but it hasn't overwhelmed us yet. So it's a nice time of year. I'm always happy to be here. So I'm a farmer. I started the farmers markets in Half Moon Bay 20 years ago because we didn't have one. And it's something that I've noticed in my life and time, is that most of my successes have come in places where I've noticed that there was something missing. And so we have farmers markets in Half Moon Bay and also in Pacifica. I'm also part of a loose group that just recently organized an alliance of farmers markets, a small industry group for the state of California, because farmers markets are operated independently. There are 800 of them in the state of California that serve the needs of over 3,700 very small local farmers and their families, and that's a lot of people. Anyway, we became involved with the county prior to all this, and they asked us to work with them on the census outreach project, and we were invited to be one of those partners, because we're in a sort of a central location where all sorts of people from the public from across the spectrum make it a habit of being there. We always say we throw a party for a couple thousand people twice a week. We have a very dedicated group of individuals in all of our locations that make it a part of their week, a part of their habit to nurse their families in this way, and participate in the basics of community, because there's not much that's more basic and connecting than the reality that, whether you're a high-end restaurant foodie diner or the person that's growing the food, everyone's an eater, everyone. And so we're kind of in that interesting place. We have served as a community bulletin board for a long time, and this pandemic has really brought into very sharp focus those, because we were some of the only functions that were happening where individuals from the general public were coming to a place that was outside, and we worked really hard to make sure that all our markets were really safe and as welcoming as they could be, without them being the sort of street party things that some people think of farmers markets as being. So what we decided early in all of this was that we were going to be as visual and analog as we could be, because that's how farmers markets are. And it turned out to be a really great way to fill in those gaps that the digital divide has made so clear. That the pandemic made the digital divide really clear. And while it's the most oppressive and the most difficult for folks with minimal resources, that lack of internet and cellular connectivity on this huge part of San Mateo County impacts everyone. And it doesn't matter what end of the socioeconomic spectrum you find yourself on. If you're living on a ranch south of San Francisco, in the south part of San Mateo County, and actually in the certain areas where I am, the assumption of connectivity and contact is a false one. So I sort of went on a little tangent there, and I apologize for that. But anyway, we found ourselves in a position where we were dealing with a minimum of 1,150 individuals from the community at our markets every week asking questions. So we decided that we were going to have some fun with it, and understanding the gravity of the situation, we just made a commitment to get really visual and fun with stuff. And we had signage all over the, let me see, I'm trying to figure out how to advance my slides here. That just let people know what the deal was, what the conditions were that day. We made sure that we had lots of outreach so that we had individual times for seniors and immune-compromised folks to enjoy the market. We had goofy references to all sorts of things about, social distancing and all that sort of business. So while this was all coming up, we just made ourselves as much that was relevant to the market and as relevant to however and whatever interests people might have as they're coming through. We developed these things where we had just big eggplants all over the place when we were in that purple tier, and bright red peppers when we were in the red tier. And we had this very clear entrance with fun signage. We made a point to always have lots of information right at the entrance and the exit. We had developed one way in, one way out things so that we could meter people. We had made it really possible for our farmers to stay healthy and safe. We developed signage and gave it to them so that they didn't have to. We developed this little app where all of our staff and our volunteers could just hit a button and their phones would start doing stings, "Don't stand so close to me," just really loud. That was sort of fun. And by doing all these things and just sort of making it possible for our farmers to stay safe, we developed an even deeper connection with those farmers and with our shoppers, so that by the time the testing came around, we'd already been working with the census folks to collect information, and they were trusting us to do that. We had laptops and whatnot at the markets and people that would help folks who didn't have that kind of access. We still have those now, so that if there are people who are having a hard time connecting online, we got a hotspot. We keep a laptop that has nothing on it but a search engine and a hotspot, so they can register or try to get on the My Turn Now. And that all just came from working with these different parts of the county, with our WIC offices, with Congresswoman Spear, who's amazing, comes to the market. She just came to the market to tell people to not be scared, and it was so great. We just continued to, he didn't actually show up, but we had fun with that one day, so I decided to throw it in there. But we just spent all of our lot of social media capital. We did all sorts of fun things about, during the holidays, about trying to have people keep things short and small. But again, this kind of thing, we just had some fun and made a lot of friends, so that by the time the vaccine rolled around, they trusted us and came to us in all of our locations to find out what they could. We have really healthy email lists and things like that, where I just got an update yesterday from Coastside Hope. It's one of our partners out here, and could put that out to 1,600 or so people who live on the coast, and we're within 5 minutes of that to get those things out. And we just we discovered we got all kinds of masks, from the city, for the county. They were white, just plain cotton white things. People didn't like them because they said they felt like they were putting a pair of tidy whities on their face. So we just spent a day tie-dyeing them and had fun with that. And this is Colleen. She's one of the ones who works with us. And we just participated as much as we could in all these programs and tried to just do our best to, be that community bulletin board that we have always sort of known we were. And the great thing about it is that through this period, because of our connection with the California Alliance of Farmers Markets, and we're also one of the founding partners in Market Match, which is it's a service that's available for folks who participate in CalFresh at farmers markets. They can double their benefits there, and we're one of the pilot partners in that. We also have all kinds of grants with different farmers market organizations that allow us to match benefits for WIC families. In the Half Moon Bay market alone, we administered over $35,000 in one farmers market season in matched benefits. That's a lot of economic engines going into our farmers, and our farmers who work with us at our markets, even ones who are not from our county, have really recognized that and have been, like Rita said, during this whole period, San Mateo County, I feel, has done a really good job of honoring their commitment to equity as far as farm workers go. And having Rita's organization down south and Coastside Hope up north. And I sort of sit in the middle of those two things. I am not a healthcare provider or a community service provider or a safety net provider, but we are a central meeting space. And so having that, having those relationships with our folks, because, you know, these are people who are coming to us every week for years, to do that very basic thing of feeding their family. And I think that it remains actually really challenging to keep up with the information, to be in that position where you find yourself as a filter for a lot of people's fears, concerns, frustrations, anxieties. And in a lot of cases, just like public pushback, we find ourselves in interesting experiences, I suppose you could say, with anti-maskers, anti-vaxxers, and the highly politicized response to the pandemic as a whole thing. And so I'd say that, like, for future reference, or when this happens again, looking towards those, I think that Ruben described them as non-traditional partners, or maybe that was Mike, sorry. I would say that we are about as non-traditional a partner as anyone imagined at the beginning of all this. But I'm hopeful that we've been effective in not just the markets that we run, but we've sent staff up to the markets at the College of San Mateo, Daly City, Belmont, the one in South San Francisco, the one another one up in the North Bay. Sorry, I said Daly City already. And so having that reach into all parts of the county in a place where people didn't expect it. Over the course of the last 4 months, with all our little clickers and tallywhackers, we had personal interactions with 7,542 people. And that's a lot of people to point to a website or get them a phone number or recommend that they connect with this service or that individual. And it's been quite a ride.
Erin, that was so amazing to hear your experience. And I think I speak for everyone who's listening that your messaging is probably the most creative I have seen this whole pandemic. Those were absolutely delightful. My colleague Wei Ting is texting me saying the amazing message is that you're a wonderful example of how promoting vaccinations and, addressing the pandemic is not just the healthcare organization's responsibility, but so many organizations have come together to step up like yours. And we are truly so grateful for that. So really appreciate you sharing your story. So I'm going to throw out the first question for our panelists, and I really think that each of you could answer this question. It seems like we are arriving at a new stage of the pandemic. We have a significant proportion of our population who's received at least, one dose, and in some cases 2. So I think what we would like to know from each of you is, what do you see for this next phase as the most important steps we can take? And maybe add what kind of resources you could use or what kind of help you think you would need to address the challenges that are coming ahead. I don't know who wants to start. Maybe we can go back to Ruben, since you've had a rest while everybody else was talking.
Yes, well, I think that the next this next month, I just see it as a very intensive period. I think, as Erin was saying, my message is really, it's everybody's responsibility at this point. Every organized group in the community, whether they see themselves as playing a role or not, we need to appeal to them to get as many people to the vaccine sites, because there are more opportunities now. And then, now that there's some, I don't know the rate, I don't think it's very high. If some people who have missed their second dose and then show up at a place, but I did witness, one case where I think people feel like there needs to be a little more coordination with whoever's doing the vaccines, wherever they are in the vicinity within a few miles, and people should not be turned away. or should not be left with the idea that now they may have to start the first dose again if it involves 2 doses. So I think, that may be at the higher level of the people running the operations, that they make room for that people show up. I think we need to open it up much more. No appointments necessary. If people come wherever they are, you find a way to connect them. Because those are the kinds of things that discourage others. If they hear a bad story, all it takes is 1 or 2 bad stories to then others feel like, well, this or that. So I think that's one of the, and I know that, I mentioned one of the flyers we put up. We're literally going to go door to door. We happen to be very self-contained community with a lot of people. So at this point, we need to go out there and even recruit other volunteers to help. So
that's great. I think we've definitely heard from each panelist or most of the panelists, that the appointment process can be a barrier. So the extent to which we can facilitate access with no appointments or really easy to access appointments. Thanks, Ruben. What other panelists would like to contribute?
I would like to
Rita.
I would like to add a few points that I think is what's going to happen next. One is we need to continue masking when it's necessary. I know some of the restrictions are getting a little bit more light, but enforcing that message. And I totally think that we need to redo our signs now that we saw Erin's signs. So I need to talk to my team about being more fun. But also, if this may be for other groups to share as well, we're going to have to start addressing mental health. There's a lot of loss, there's a lot of pain, not only among the community, but also within the organizations. We've been at the front line for a long time, and we have done our work to take care of our own wellness, but I think with some sacrifices, and especially immigrants who are not allowed to travel to visit their parents. They've lost fathers, mothers, so I think that's going to be a huge issue. And I hope that our authorities and groups are already thinking about where to put the money for the next years as well. I don't think that we're done. I continue hearing about these variants, and I don't understand much about it yet. So it's like this unknown. So that's why we need to watch out. And the last thought that I had is we still need to figure out what are the solutions for the younger. I don't know if they're going to end up vaccinating, at a very young age, but at least, children that are already going back to school, that are already interacted with one another, what's going to be the way to keep them safe.
Wonderful. Rita, you, I think, just wrote the script for our next 3 or 4 town halls with the topics that you brought up. I couldn't agree more that addressing mental health is important for a whole community, but I'm really glad that you pointed out that some of the people at the front line, like yourself and your coworkers, are going to need support for the hard times that we've been through. And it sounds like information about variants would really help the whole community. I think there's a lot of misinformation out there. And in some cases, just so much information about different variants, it's hard to know how to make sense of it. And we are also really thinking quite a bit about how to support parents and families in making decisions about vaccines for their children as they roll out towards the end of the summer, fall, and early next year. So thank you so much for bringing up those important topics. Mike, I saw you nodding. I didn't know if maybe you wanted to go next.
I can go next. I have a lot to share, but I think Erin, did you want? I think she came in earlier.
Got it.
Be respectful.
No, thank you. I actually was going to what we are already experiencing out in the community is this a real concern with we used to with mixed vaccination status within households, and how to manage that tension. And the other thing that Rita brought up so well is that business of really acknowledging the grief and the loss and the just difficulty that this has just leveled on certain groups of people in really disproportionate ways. It's I feel it. I mean, I have one granddaughter. I haven't seen her since Thanksgiving of 2019. She lives in Topeka, and I'm vaccinated, but my partner is not. And like, what are you going to do? And that is a real thing. Then there's a big wave of that coming up. There's a big wave of people who may find themselves displaced, homeless or unhoused, or having to move. And how do we keep track of those folks if it turns out that the variants are going to require a booster 6 months down the road? Like, because we don't know. I mean, the whole world right now is participating in one ginormous clinical trial, and and the outcomes are unknown. But that just underlying tension and fear is there, particularly in this place right now, where you have advice from the CDC saying it's fine to be outside without your mask unless you're in a potentially crowded situation. And like, what does that mean? That sort of ambiguous language is so unhelpful, particularly, of course, I'm looking at our situation where here we are outside and sometimes on public streets, and the kind of pushback from the public and the lack of understanding that you can still be circulating a virus around even if you're not symptomatic and even if you are vaccinated. So it's tricky, I know. But Mike, I'll let you keep talking.
And thanks for bringing up the masking, Erin. I didn't mention that, what Rita said. It's been hard for us to know the right thing to do all along, and we've tried to share the best evidence. And I think we are going to have to be, helping out our communities to know what's the right thing to do with masking, and for a while, right? And helping people to know what the recommendations are. So thanks. Okay, Mike. Take it away.
I mean, it's a lot to say here, Lisa. So when I think your first question was like, what's next in this phase? And first of all, I acknowledge what's going on in India. It's heart-wrenching what's going on out there. And, I think as a country, at least what I've read about it was like, they turned their back, right? They sort of, what we did a few months ago in October, we kind of opened up and people got really comfortable, and then boom, right? And so we're still in a crisis mode. I think a lot of people think they're already exiting this pandemic. Mm-hmm. This pandemic will last for years. I mean, my work before coming to the health plan, I was overseeing the division of equity for the county of Santa Clara. 20% of our East Side residents have not fully recovered from the 2008 recession, right? So this is going to be a long effect. And for those of you who are public health folks in here, like we know, like it's all about behavior change now, right? People who wanted the vaccine, they got it already, right? So how do we now focus around behavior changes? And there's a spectrum of behavior changes. And so I mentioned some of that earlier, but really, like, how do we do that really, really well? I think when we think about the challenges ahead, I mean, so beyond the vaccine, which of course, the vaccination sounds like there might be a booster shot needed, right? Again, in 6 months to a year. And so we got to really focus on that as a public health campaign. But also when we think about the social needs, right? I mean, the moratorium will go away in June, right? And even for those who are currently Medi-Cal recipients, right? There's also a moratorium that we're holding people as insured, right? And so there might be a lot of people losing insurance at some point. And so it could be a domino effect, right? And so there could be a lot of challenges. And I think right now it's sort of like this, like the eye of the storm is really calm right now, but we have to get ready. We cannot turn our backs. And so there's just so much to do in terms of being really thoughtful in our partnerships. I think in the beginning of the vaccination process, like we all were rushing to do whatever we can. Now it's time to be thoughtful and intentional. And that was what I was saying earlier. Let's really do that. Let's not exclude people. Let's really bring people together. By the way, when we were a part of this conversation earlier during Rita's, I got a text of another vaccine clinic opening up, and they're actually doing boba and cookies, right? What a great way. I mean, Rita and Erin, I think we should do horchata and conchas, I think maybe for us, right? Maybe, I don't know, but we have to do a lot more. We have to be thoughtful and we have to be intentional with this. And so anyways, there's so much to think about. I wrote a bunch of notes, but I don't want to go around, I don't want to digress too much. So I'll pass it back to you, Lisa. Thank you.
Well, I think one of the things you brought up that, you really highlighted for me was that, we may get to a point in the pandemic where the transmission rate is significantly lower and we may consider the pandemic to be more behind us. But mentioning what happened in the 2008 recession, the effects of the pandemic are going to be with us for years to come. And so there's a lot of work for us to do, beyond the vaccination phase that we're in right now. We'll have a lot of support of our community to heal and to grow and recover. So thanks for mentioning that. Tim, how about you?
I think similar to what everyone said, that sort of the long haul nature of what's ahead is one of the challenges, and keeping everybody okay with its small incremental changes that are going to happen for the months and months ahead, instead of these large waves of vaccination that we got. And so keeping focused on the fact that those small increments are still really important to our overall communities. I also think one of the biggest challenges is kids right now, and mixed vaccination status, and adults starting to change behaviors, but kids not being ready to, and not knowing when our 5-year-olds are going to be able to be vaccinated. I think it's just challenging on all of the communities that want to go back to some level of normal activity. And so how do we continue to pull families toward us and think about how we help them have a little bit more stamina as we get ready to vaccinate kids, and that's going to come in a couple more waves as well. So consideration we're thinking through too.
Absolutely. Well, we're in the Office of Community Engagement excited to partner with all of you to help support our communities in the phases around childhood vaccinations that will come. So it'll be great to address that. One thing that we know has been common throughout the whole pandemic, from the very beginning to rolling out testing, and of course during this period of rolling out vaccinations, has been combating misinformation, right? And one of the whole goals of this town hall series has been to provide really high quality information direct from experts to our community, which is why I've loved them so much. I thought it might be nice to hear from each of you how you have addressed misinformation in your different roles. What kind of strategies have you used? Because I know we'll need to continue to use them. So who wants to take that first?
If I can share, Lisa, so in our county, Santa Clara, I'm not alone on this, by the way, and I actually had a slide on it, but I had to cut back, and so I didn't share it. We actually created a stakeholder work group back in December of 2020, so not too far ago, when we knew the vaccines were coming, and we knew we were going to be dealing with a lot of different concerns and barriers and issues when it comes to that process. And so we have a work group. Is actually, I think, totals around 150 different CPOs and different sectors, so business, faith-based, and so all these different organizations that come together, and we created subgroups so we can really be in tune with what's going on in the community. And so what we've been doing, though, is actually meeting on a weekly basis to really understand what people are saying. And most recently it was all about the J&J, right? I mean, the J&J went away and now it's back. And so how do we currently provide information around that? But most recently, before the J&J, it was all around, within the faith community around, what created the vaccines, and are there really babies, embryos in them, right? So we want to hear it. We want to be ahead of it, right? So we hear it, and then we get together, and then we strategize on how best to combat disinformation. And we have several different platforms to do that. Whether, again, we come up with sort of the think tank of different sectors that come together and actually, again, hear it. What is the right information, and how do we deliver that, right? Via different vehicles, whether it be social media or ethnic media, grassroots. We do have the County of Santa Clara actually has community health workers that we activated that goes door to door to inform people. So a lot of different strategies there, but really it's about just getting people who work with people, right? So again, it doesn't have to only be CBOs. We're talking about businesses. We're talking about churches, the faith-based, very different types of people come together so they can, again, share what they're hearing, and how can we get in front of that before it gets out of control in terms of information.
Thanks so much, Mike. It sounds like there's some great lessons learned even for other crises that we might face in the future, God forbid.
Lisa, I was
Ruben,
going to...
yeah, please, go ahead.
Yeah, from a perspective of an elected official, I really feel that every city in the county, we know where that populations are concentrated are the most vulnerable, but literally every city has some census tract or some area where people are very vulnerable. And so in addition to the county, I think every city, we've done what we can. We probably can do more. Every city needs to put some resources into their communication system in order to bring together different stakeholders at that local level who are already involved, or if not involved, they're invited in and provided with that solid information. I think that's a big vacuum that I've noticed. It's sort of, you can't leave, the county is responsible for public health. And unfortunately, I think the system is, it's just been fragmented. It's getting better, but you can't just leave it to the county. Every city government, as far as I'm concerned, needs to put some resources and convene people together. That's why we're elected. We're elected by the people to take care of the people. And so if they don't hear from us, and from all the other groups that are doing work, if they see us together, I think it's a much stronger message. I just don't see enough of that in all the different cities. And I think that's a lesson learned for local government, that you can be hands off. And if you have some extra money, use the money now, not later, for resources.
Thank you so much, Ruben. That's a really important perspective. Appreciate that. I want to give anyone else a chance if they want to talk about how they addressed misinformation.
Lisa, I think, one thing we recognized is that, first of all, wow, it's so hard to keep track of the information. It was moving so fast. It was changing. Do I wear a mask? Do I not wear a mask? How do we keep the public's trust when we keep changing the guidance, right? And so as a healthcare organization, we felt we have to be responsible, at least for passing information on to our workforce. And we're a workforce of 30,000 people, and our doctors and nurses and housekeepers all live in different communities. And so how do we arm them with what we believe is the truth today and what is the information, so they can go out and educate their peers and their families. And so, and also doctors and nurses carry a high degree of public trust, right? In sort of ongoing public opinion polls. They're very trusted professions. And so I think what we focused on was all of our internal communications, really trying to make sure we're cascading to everybody in the organization all the time, knowing that they are a marketing campaign, because people say, oh, you work at Stanford, you must know something. So we want them to be able to answer, yes, I know something. It's okay, you can do this or go here. And I think that helped us feel like we were helping disseminate information.
We do get wonderful messages and information every day in our email inboxes here. So it is hard to keep track of. Rita, did you, Erin, hi. Yeah, go ahead.
I was just going to say that in our situation, we made it a point of our practice at the beginning of this and during the couple months we were off season to just be extremely consistent with the basics. And that's really helped us. We never wavered, even when things started to lighten up a little bit over the summer around masking, distancing, metering our entrances, our signage, all of that. We haven't wavered a bit in terms of what our expectations are of the folks at our markets. And I think that's really been helpful. Just basic consistency about the basics. The rest of it seems to be, there's lots of moving parts and not necessarily conflicting information, but compounding levels of the same information. And language is a powerful thing, a word shift in one direction. The difference, say, between vaccine hesitancy and vaccine barriers, those, all the other much more intricate things that folks like most of you on this town hall are involved in the medical profession. That's just not our first language, right? But it's really helped us in terms of messaging to the community to have consistent points of contact and consistent messaging and consistent expectations of the public when they're there. And I've been told that that's been really helpful for other organizations and school groups and a couple of sports groups and mothers clubs and things about how to handle their gatherings and as things change in the community in terms of the pandemic.
Thanks for sharing, Erin. I agree. I think that sticking to the very basic messages helps to promote trust and really helps people to, I think, maintain their behaviors, right? That's wonderful.
I'd like to mention just three quick things.
Sure.
Is the county of San Mateo had been the one actually preparing a lot of the information for us so we can just repost it and share it. And they've done a really good job on doing multiple languages and all that. In addition, we have done a few videos that are, ourselves or our staff, people that people know in our community and in their own language. And then we've done some of these events like, over Zoom and over Facebook. Now that the community has become also more comfortable over some technology. But I think the key element, it has been people that in our community, the people that we're reaching out to, Spanish speakers, that there's been a presenter that is fully bilingual, that is like a native Spanish speaker, that has good charisma, that throws some jokes and it just engages people. So that has worked out. And I think we should not underestimate also, the hesitations that people have. We need to acknowledge that, there has been harm, through healthcare in other times. And so sometimes people are hesitant because of that. We have to acknowledge it. And then it should not be like a one-way communication. This is what you should do. It should really be a dialogue because the people that we're trying to serve are pretty smart and they have, they're wise about what is best for them and their families. And sometimes it's just access to information, but we should definitely have more like a dialogue than a one-way messaging.
Very well said, Rita. I really appreciate that. So we only have a little bit of time left, and I'm going to ask you a difficult question that you're going to have to answer with just a few sentences. So you all have done the most amazing jobs of engaging your respective communities. Can you say maybe one or two sentences about what you've learned that you think we can apply to another crisis like climate change, wildfires, the things we know that we have to deal with in our communities as well? So Ruben, I'm going to ask you to go first because you've been our fearless leader all night. And I see Mike's freaking out about thinking of something, so it'll give him a minute. You're a politician, so it'll be easier for you.
Well, what I see is that planning sooner rather than later, just planning sooner rather than later, because that people need to come together. They need to do some planning. They need to do how they're going to deploy resources. They need to identify the vulnerable populations. And we know all of that. So I think having a plan and practicing it, literally practicing it, so that ultimately it's a human problem. We sort of create the problem. And the solution really is getting people together way ahead of time and mobilizing the community. I think that's important too. But the community needs to see that some people are in charge, that some people are planning, that some people know what they're doing, that they have a message. And then I think people respond even more. So.
Wonderful. So we need to be organized and plan ahead. I think that is a wonderful, wonderful message. All right, Mike, how about you?
So I'm just reflecting over the last few months, and I think to your question around like utilization of a process that would work in any given situation, we have to invest in community engagement, whether it's like an office at the county or some public organizations, really focus on just community engagement for different types of groups, right? Our immigrants, our LGBTQ, so forth. That's one. And then two, we have to be thoughtful and build really meaningful partnerships. We forget sometimes, we get busy, you forget about partnerships, you call them when you need them. We have to continually to build our partnerships so when something happens, we're all ready to be activated. That's it.
Love it. Absolutely. More investment in community engagement. Okay, Rita, you're next.
The two things that came to my head, one is planning, but I think for us, it was very useful to always have a plan A and B, sometimes a plan C, and things went wrong and we have to use the other plans. And evaluating what we do with humility. So we try our best. We messed up a couple of times and just be open to that feedback and just, adapt and do things a different way, a better way. And the second one is invest in your teams. This response has been good because we have people at Puente that have been here for a long time that we have invested on, we have nurtured. And if it wasn't for the team, it would not have been the same response.
Wonderful. I'm sure your team appreciates that, Rita. I hope they got to hear that. Okay, Tim.
I think one of the most positive reflections is obviously just sort of people's resilience. Human resilience is so fascinating, and it's been so impressive. I think my biggest reflection is our democratic republic has many strengths, and the pandemic showed us all of our opportunities for doing a better job about coming together, and that sort of disaggregated services are very difficult on all of us. And so these lessons that what Ruben and Rita and Mike just shared, the quicker we can come together as a unit and start to solve problems, I think is really helpful. And I think that could be globally, more global education for us too. The quicker counties come together and states come together to solve problems, we're very likely to go a lot faster.
Have to all work together. And Erin, you're going to get the last word.
Oh my, good times there. Well, I would just like to build on the comments that have already been made about building on those networks that have been created during this period. And that idea that not just calling on your community partners and your untraditional community partners when there's something wrong, but when there's something else going on. I mean, keeping communities engaged can't always be about crises and panic modes. And I think that there's been a lot of work between what community groups like ours, like Rita's, like a lot of you on here, have had to deal with the pandemic, also during a time when we were dealing with a census. And it's been really interesting to me how those have collided really in terms of individuals in marginalized communities. I mean, we're seeing the impacts on what's going to happen with California. It's going to be compounded by the reality that the census happened during a time where we could not reasonably, easily, readily collect folks from folks who are unlikely to respond in the first place. But there's been lots of work done there where that have helped ameliorate, if not end, some of the distrust that many, many people reasonably have around government and where their information goes and who has that. And right now there's all sorts of people's personal information in all sorts of places, and it's all kind of siloed for all kinds of good reasons. But I think wherever we can, to be able to build on those networks that we've developed and be a little bit less precious about making them our own and not the community resource that they are, might be a helpful thing to move forward and addressing these things that are going to happen in the future. It may not be a pandemic, it may be a big earthquake, it may be something else, but and there's an awful lot of connective tissue that's out there. Then figuring out how to harness that and best use it without exploiting it or abusing it is going to be a challenge for all of us.
Beautifully put. I'll say that strengthening our connective tissue is definitely a goal of ours in the Office of Community Engagement. And you all have done that by participating tonight. And we want to sincerely and humbly thank each of you for sharing your stories tonight, and also for all the work that you've done up until today and what I know you will still be doing when you wake up again tomorrow. So a huge, huge, huge thank you. We are so, so grateful. All right. With that, we'll sign off. Thank you, everybody, and good night.
Night.
Thank you, everybody.